I remember eating at a friend's house one time, and she asked me if I wanted raspberries. And I said, "Ooh, I don't like raspberries." She said, "Have you ever had a fresh one?" I was like, "I don't think so." She gave me a fresh raspberry, and I was like, "Oh my goodness." What's interesting in women's health is for so long, people haven't really talked about women's health, especially menopause and midlife. And now this is a billion-dollar business. Are you going to go exercise when you're not sleeping?
That's a good point.
You're going to hit the snooze 20 times and then drag yourself out of bed, get 3 cups of coffee, and go off to work. Most people are not choosing the healthier options when they feel bad. The most important thing is to empower women to better health.
Welcome back to another Spectruss Speakeasy podcast. I've got back again Dr. Patricia McLelland, Galen Medical Group. It's great to have you back again.
Thank you so much. I'm glad to be back.
Got some big news I think we can talk about today.
Absolutely.
Some fun announcements to talk about. Fill us in what's kind of happened, maybe give a teaser of that, but what's happened since last time. Also, people can't see outside the cameras, but there's a brace over here. So
yes.
Recent surgery.
So I had shoulder surgery about 2.5 weeks ago. Slowly getting back into things, but it's actually quite a long recovery. Lots of physical therapy.
Yeah.
Not the most fun. But I've also been working on a book, and I completed my final edit during this whole process of recovery.
Oh, nice. That's awesome. Congrats on that. And
thank you.
The shoulder surgery, was it a tear or what rotator cuff?
Well, I had a nerve impingement, labrum tear, and an issue with my biceps. So all of that was fixed.
Oh, wow. Is that just from, I know you're, big into outdoors and moving active. Is it from some sort of sports injury or?
It's more chronic wear and tear, the combination of outdoor activities and what I do for work. I was telling somebody the other day, I said, if you don't realize the person delivering your baby, it's actually quite physical. But I don't expect you to be looking and saying, this is physical for you.
Yeah. I've never seen that or experienced that. So it's very interesting, quite physical. So like catching a football or a lot more work going on than that?
Sometimes it's that easy, and sometimes it really isn't. And it can be very physical.
Yeah.
Taking a lot of energy. Like everybody needs to pause and catch their breath afterwards because they've expended a lot of energy.
Wow. So how is it working with the shoulder then? I guess can't do that
I'm
part
not doing
now?
any of that right now.
Okay, but still seeing
I'm working
patients.
in the office. My brain works fine. My left arm works fine. My right arm is limited. So the good thing is my brain works well.
That's good. It's good. Clearly it works well. For those that don't remember from last time, Vanderbilt undergrad, double major in mathematics and chemistry. That's very unique. I mean, adding the mathematics part too. I don't feel like that's something common, or maybe I'm just not up to speed with it, but I think that's pretty cool.
I loved it. I loved both the math part and the chemistry.
28 years practicing.
Correct.
We had to get that nailed down earlier. Went to Emory for residency, wound up going to Oregon for a little while, and actually that's where a lot of the book kind of motivation for the book originates, right, from Oregon, and then worked your way back to Chattanooga. But, I mean, I'd love to hear more about that process. I'm sure listeners do too, because that motivated a lot of this book. So tell us some about that, where it started from.
Well, you had asked me what are some of the pivotal points when I was thinking about this book, and there's a couple pivotal aha moments. One was in medical school, and one of our professors asked us, what does doctor mean in Latin? And doctor means teacher. So I'm sitting here going, So I'm supposed to learn absolutely as much as I possibly can so I can teach you to take care of yourself. I mean, that's what I was supposed to do. And that's been the underlying premise of everything I've done ever since then. I want to learn something every day. My son, when he was little, he told me he didn't want to be a doctor. And I asked him why, and he said, because you're always reading. And I said, it's because I love it. And I want to learn so I can help somebody new or somebody differently every single day.
Yeah.
So that was pivotal in this idea of teaching, and it creates a more collaborative relationship than a paternalistic. So if I'm teaching you to take care of yourself, then you and I are having a conversation. If I'm just doing something to you, you don't ever have to say anything. I just do it, give you a pill, do your surgery, and you don't ever have to speak. But really, to thrive, it needs to be collaborative.
Yeah. And you put it like that, that sounds so logical, yet that's not the majority of the way it's being practiced or how people are practicing in normal. I mean, especially with pharmaceuticals in the United States and how that's kind of just a throw it at everyone, it feels like. But I mean,
Have you heard of the term evidence-based?
I think so. How do
Yeah.
you mean that in this case?
So when you're talking about evidence, you'll hear that terminology thrown around a lot when you're talking about medicine, science, what's evidence-based. And evidence-based, one of the definitions really is, first of all, looking at the research. What does the research show? Is the research any good? Another part of that is the expertise. So, for instance, my expertise. But the other thing that's included in that is the individual, the patient's values. Because
Okay.
really, that's part of it. I can tell you what the research says, I can tell you what I think is going to work best, but what meshes with your values? And that makes a huge difference because if I make a great recommendation and it doesn't, like for instance, I tell you to take a pill and you said, I don't want to take medications and I don't listen to you, are you going to take that pill? No.
Right.
And are you better? No. So who have I helped? Nobody. I just thought I sounded good.
Yeah. Right. Right.
And that's not the goal. I mean, it's fun to sound good,
Yeah.
but that's not the goal.
So you heard this definition of doctor, a Latin
Correct.
definition of it. It got you more on the path of teacher, and this was in Oregon early on. So, like
So that was in medical school.
okay, before.
And then as I started practice, I realized and understood so many of women's health issues are lifestyle based and have lifestyle impact. And probably the two areas that I felt that I was least able to help women was PMS and PCOS, so premenstrual syndrome and polycystic ovarian syndrome. And what we're taught in medical school or after is here's the pills for the different types of symptoms that you have. And really, lifestyle plays such a huge role. And at the time, most women weren't asking, what lifestyle changes can I make? But when I moved to Portland, Oregon, they wanted to know the lifestyle changes. And they're like, yeah, I don't really want a pill. Maybe take some supplements and botanicals. Not only, and that was the other interesting thing, because for some people saying they want a natural approach, it just means they don't want prescription medication, but they want supplements.
Yeah.
But out there, when they said they wanted a natural approach, they meant what I consider a natural approach, which is looking at nutrition, exercise, sleep, stress management, and supplements, and looking at that whole picture. And so I felt bad because people were asking me fabulous questions, and I wasn't giving them good answers or good solutions. And so that really piqued my interest and really started shifting some of my research into what are the lifestyle changes. The other thing that was so fascinating for me is when I moved to Portland, even the most basic grocery stores had good produce. They had local produce, organic produce that actually looked good, and most things were not wrapped in plastic.
Yeah.
And that wasn't just in the wealthy neighborhoods, that was everywhere.
Yeah.
And the number of people that just moved was dramatically different as well. But when it comes to the food, I saw it in the grocery stores. I saw it at friends' houses when they were cooking. It was whole foods, minimal processed. And then in the restaurants, that's when farm to table started getting big and was pretty big in Portland. And I remember eating at a friend's house one time, and she asked me if I wanted raspberries. And I said, "Oh, I don't like raspberries." She said, "Have you ever had a fresh one?" I was like, I don't think so. She gave me a fresh raspberry, and I was like, oh my goodness, that's so good. And then I had a salad that everything was from her garden. And these are professionals. These are
Yeah.
not just people wanting to live off the land. These were professionals. They had a garden out back. And the other thing was, wow, this is good.
Yeah.
This tastes good. And, you're not going to want to eat something you don't like.
Right.
If it tastes, if you take a tomato that is in the grocery store, usually they're kind of mealy.
Yeah.
But if you get a tomato off the vine in the backyard, they're actually really good. It tastes totally different. And so our taste buds don't like it when it's not good. And it just it's a huge difference. So that played a huge role. And also seeing that approach normalized.
Yeah.
It was part of the approach of most people. It wasn't just a select group.
Right. Now that seems, it's kind of early on. I mean, we're still not like that in Chattanooga, I feel. I mean, of course we have Whole Foods and we have better grocery stores and that sort of thing. And that started probably coming around about the same time because this was probably like 2000, early 2000s, mid 2000s, something like that.
Yes, early 2000s. But even here, you go to grocery stores. I went into the grocery store that I go to and said, I really only eat your produce that's not wrapped in plastic. And even if I'm planning to cook something and I get it and it's wrapped in plastic, I probably will change what I'm going to cook. So I asked the produce manager, I said, how often do people ask you about that? And he kindly basically said, you're the first one.
And that's recently you've done that.
That was last year.
But so 20-something years later after your
Correct.
experience.
Correct.
So this is I don't want to dive down rabbit holes because I've already said.
Yeah, a little bit of a rabbit hole, right?
But just a little bit of one. Why do you think that is? Like a difference between Oregon, really ahead of us, us as Chattanooga, Tennessee, kind of the South. And I do have my own I'm curious in your experience, like why is it that Oregon was ahead, still is ahead of like better food and
In
people?
that way.
Yeah.
There are some areas that it was ahead and some areas it wasn't. Or I should say differences. I don't have a good answer, but it is kind of interesting that I've gone to the same grocery store for like 2 years, and it was 2 years into it that I would finally ask about it.
Yeah.
Just being busy.
Yeah.
Being busy. It's like, okay, I'm going to pick the better option, and then I'm just going to move on instead of stopping and inquiring why.
Yeah. So of the patients you see, I mean, how many of them are aware of what you're walking them through? The areas that you're focusing on with food, and lifestyle, basically. Is that new to them or?
I would say for some people it is very new, but I do have the reputation of having this approach. And so if somebody chooses to come see me, they already have a sense of how I approach health. So it's not completely new. And what's interesting in women's health is for so long, people haven't really talked about women's health, especially menopause and midlife. And now this is $1 billion business, and there's so many people stepping into that space. So women went from let's not talk about it and kind of suck it up to now everybody's talking about it. And what is good information? What is misinformation? What is marketing my product? And it can get very, very confusing and very hard to follow. And the other thing is if you get, you need to try this product, well, that product might help one person in one situation, and it could take 2 to 3 months. But people aren't given that perspective. And so that's one of the reasons why I wanted to write this book is a long time ago, I started writing my own patient education information because the basic patient information that we had in our office was from the American College of OBGYNs, which is primarily surgery, medications, and then there might be one sentence about, if you eat healthy and exercise, that's going to be better.
Yeah.
And it's like kind of an aside. And what I wanted mine to be was more about helping women stop first, pay attention, and start figuring some of these things out for themselves. So the basic premise of the book is, or I would say my goal, and this is not just for the book, but this is life every day, is I really want to help women understand what's happening in their bodies, period. But the book is about midlife and menopause. Also, to notice their symptoms, not something as something we need to quickly fix, but to really pause and see that our symptoms are really signals of what's happening in our body. Our body is signaling to us it needs something. So, what does it need? And then the framework that I suggest is the integrative framework, which is lifestyle changes, nutrition, exercise, sleep, stress management, supplements, and medical therapies.
Yeah.
And really using that framework to create an individualized plan, and not just for quality of life now, but in the future as well. So I'll give you an example. You could have 10 women walk in with feeling bad, not sleeping. One of them, it could be because they're thyroid. Another, it could be because of blood sugar issues. Another, it could be menopause. Now, if I treat them all like it's menopause, one's going to feel a lot better, and two of them probably aren't going to feel much better. So if I pause and try to figure out what else might be happening, get more tests, etc., then I can tailor my treatment, and so somebody feels better sooner. And if I give you a treatment and you feel better sooner, then you're all in. You're buying in to your health. You're like, oh, wow, this worked, and I want to even feel better. So that's a basic. Does that make sense?
Yeah. Yeah, it does. How do your patients, I guess it'd be new patients, how do they respond to this first? Because I see there being a difference in what you've already talked about and what I've experienced myself as well with the doctors, or I guess healthcare professionals of all kind. Being marketing advertising myself, I see a lot of marketing advertising because we're one of two countries in the world that can advertise direct to consumer with all the pharmaceuticals. And so I think that marketing advertising has really trained not only a lot of healthcare professionals, but also the public to think that you can kind of just throw a prescription or everything versus, what you're talking about, which maybe it does need a prescription, but it sounds like you're looking at the whole lifestyle piece first, and analyzing that. So how do new patients feel about that when you don't go the prescription route at first? Is that...
Well, most new patients, if they're in my office, it's because they know that there's that I look at the whole picture. But what is interesting with all the information on the internet is a lot of people will come in and they'll say, oh, this is my symptom. And they'll kind of say, this is what I need. Okay. Yeah. So they're kind of they're thinking, okay, we're going to streamline this. This is my most bothersome symptom, and this is probably what's going to work. Let's streamline this whole process. And I like to slow it down and look at the whole picture, get more information. And part of getting more information is giving that individual some things to read. And so they understand, hey, these are some things that could be happening in your body. Why don't you take your symptoms, look at this information, and then we're going to do some tests. And when you come back in, we'll come up with a game plan. And really, because I have learned so many more tools, I'm not intimidated when somebody asks me to start in one area or not. Does that make...
Yeah.
So, if I don't know anything about nutrition, but I know everything about the drugs, I'm going to be a little uncomfortable having the conversation about nutrition. And I know enough now that I know where I can send you once we get past my knowledge base.
Yeah.
Or if there's other, like seeing a dietitian or some other things that can be helpful. And so... sometimes people ask me, well, how do you start when you're talking about the framework? And I think there's three things that I look at. One of them is, what do I really think is going to help the most? What are your values? how bad do you feel and how quickly do you want to get better? So I'll give you an example.
Perfect.
I had and this is funny because I'm describing two patients that were almost back to back.
Okay.
They were both pretty miserable with their menopause symptoms: hot flashes, night sweats, mood swings, not sleeping, brain fog. One of them said, I'm crabby. The other one said, I'm irritable. Same thing. I liked the crabby one.
Yeah.
And one of them said, I am so miserable. I'm having a hard time doing my job. I just want to get better as fast as I can. And then I'll look at the lifestyle stuff. I said, okay, with hormones, you'll feel better in a month. So let's start hormones. Saw her back in a month. She was 80 to 90% better. She said, yay, I'm sleeping. Now I have the bandwidth to do these other things.
Yeah.
And then we incorporated the lifestyle changes. The next patient said, I don't want hormones at all. I want to do this with lifestyle and supplements. So I gave her a plan, and then I told her, I said, I just want you to know that the supplements is probably going to be 1 to 2 months, probably closer to 2. You'll probably get half the benefit you're going to get from hormone therapy. And the lifestyle changes may be 3 to 6 months. Hormones are going to take about a month, and you'll probably be about 80 to 90% better. And she sat there and she was like, well, let me start with hormones and the natural approach. And I said, how many hours of the day? She said 24. I was like, let's not do all of that. So if you want to do the hormones, let's start out with that. But from our discussion, we really need to look at your nutrition and your movement. So during the next month, a couple days a week, do a food diary, and I recommended Cal AI, but there's a bunch of different food diaries that all you do is take pictures of your food, so it makes it really easy. I said, just observe over this month. What's your movement? You don't exercise, so how many steps a day? And then keep a food diary a couple days each week, and then we'll come back and we'll look at it.
Yeah.
So here she is feeling much better, and she has more data.
Gotcha. Yeah.
Right? So if I tell her, eat more protein, eat less carbs, then she might think, I already do that. But if she has the data in front of her, it's like, oh, yeah, I need to be focused more on protein and less on carbs. And so then she's open to ways to manage that.
Gotcha. And let me ask you the difference between like hormones, because you say get to 80, 90% in 30 days, it sounds like. But then going the more natural way, I guess, food, diet, lifestyle, healthy exercise, it takes longer. But what are kind of the pros and cons of those two things? I mean, because it seems like the hormone therapy is almost instant gratification compared to the others. But is there some sort of con to that, or what are your thoughts there comparing the two?
In general, no. But if you want to thrive, incorporate the other things.
Okay.
So, but I'll tell you, when I went through menopause, it was pretty quick. I was pretty miserable. I started on hormones, and within a month, I felt back to myself again. But before I started the hormones, I wasn't exercising. I wasn't sleeping. Are you going to go exercise when you're not sleeping?
Good point.
You're going to hit the snooze 20 times and then drag yourself out of bed, get 3 cups of coffee, and go off to work.
Yeah.
And then you're going to get home, and then you're going to be kind of wired.
Yeah.
And then you go through the whole thing all over again. And so most people are not choosing the healthier options when they feel bad.
Yeah. Makes sense.
I mean, and that's human nature. So what I like about that is just normalizing it. There's no judgment.
Yeah.
No judgment at all. It's just normalizing it. And it's like, yeah, of course that's what you're going to do. So let's fix some other things so that you actually have the bandwidth to do it.
Yeah. Makes sense. And so like once they start hormones, like in this case, they probably stay on it forever, or when they add the lifestyle piece to it and food and then the rest of it, do you see hormones coming back out of the equation, or what is that normal? I guess it's a case by case.
It's case by case. In the past, there was a recommendation to be on hormones for as short as possible, and there is zero scientific basis for that, and so that's not true. So really, you want to stay on hormones as long as you get benefit. So when you're looking at hormones, you're looking at I look at kind of two categories. One of them is your current quality of life. And then the other one is, what is your disease trajectory? Your lifelong health risks. And hormones definitely play a role in, if you start them closer to menopause, you reduce the risk of osteoporosis, breaking bones, you reduce the risk of heart disease. There's some evidence of brain benefit. We don't have robust evidence, but there's enough evidence for me to say I'm staying on it until I see what the final data is. But most women, their longevity will be better if they're also on hormones. But if you, like, let's say, for instance, you're diabetic and you don't control your blood sugars, your risk for heart disease is very high. If you then go on hormones, you have not really moved that needle because your uncontrolled diabetes is far bigger issue than that little drop in the bucket for hormones.
Right.
And so that's why looking at the whole picture, if you can feel better, that's going to give you space to make changes, and then what changes are doable.
Gotcha. Now, in your book, do you go into, because I imagine this could be a slippery slope of, like we were talking about earlier, where I like to dive down rabbit holes. There's so many things attached to hormone levels besides, menopause. There's, like you've already mentioned, sleep and other lifestyle elements. But one big thing that stands out to me is the food supply. I mean, do you touch on that at all in the book? Because there's, plastic you mentioned. There's plastic in almost everything we eat, the hormones and most of the proteins we have now. Like, do you touch on that at all? Or
I touch on it a little bit, not very much, because that would be a whole nother book. But one thing I do think is we have a new food pyramid now. Have you looked at it?
Yeah.
Okay.
Yeah.
So it is dramatically different than any food pyramid that we've had. And it is the one that's closest to recommending what we need to eat, which is whole foods.
Yeah.
And so I think that with that food pyramid being government, then hopefully that will open the space for more activism in that, where, this is what's recommended, so what's available. Now, I do think it requires us to say, hey, I want this. This is now the food pyramid. This is what I want. Can I go to my grocery store and say, hey, can you not wrap the produce in plastic? If I do it by myself, the demand's not there. Why would we change? Oh, 100 people walk in and say, can you please not wrap my produce in plastic? Oh, the demand is starting to be there. And so that really changes the national lens. If you allow it to, it can change the national lens of what do we want to feed people. And it's really the most whole food based. And so if we use it like that, then I think that could be part of the change on a national level.
Now remind me, because the previous pyramid, wasn't it grains that was like the base or what? I forgot what it.
Well, it was very supportive of a high carb diet.
That's right. Okay.
And processed foods. It didn't say that exactly, but the standard American diet went along with the food pyramids, which processed foods and high carbs would be fine with that diet. And this was really focused on whole foods, protein, vegetables, fruits, much more in line than what the current research supports.
Now, the patients that you work with, was this like surprising to them? Was there any sort of fallout, or is this stuff that they already knew since they've been working with you? Or
what was new?
As far as the pyramid changing, like
it hasn't gotten the press that it would. I think it really should have, because I think it was groundbreaking to make this more research, science-based, and whole food-based than previously. I don't think it got much press, not that I could see.
Yeah. That's interesting to me. I think I can't remember the last time we talked about it or not, and I try to stay out of conspiracy theories. This one's not a conspiracy theory, but the whole sugar industry buying off FDA and trying to say heart disease came from cholesterol versus sugar, and it was for a nominal amount, like $55,000 or something.
It's fascinating.
Yeah.
It was fascinating.
And it completely changed who knows how many, multiple generations of healthcare. 'Cause I think that was in the was it late 50s, early 60s when that buy-off was? And it wasn't until I think 2017 that the article came out about it, and it even kind of got swept under the rug. I think it was New York Times or one of them published it. But I mean, how many physicians taught that over?
Well, that's what we were taught.
Yeah.
That's what we were taught too. So you're not even being taught two sides.
Yeah. That's wild to me.
I know. But then in practice, you see, hey, that doesn't work. Still people will come in and they'll have high cholesterol and they'll say, oh, I cut out meat. And why is my cholesterol still up and my triglycerides still up? And they have a very, not everybody, but people who will cut out one food are then going to eat more of the other foods. So if you're cutting out meat, you've probably cut out a substantial amount of protein and you're substituting carbs. And then the carbs are going to keep your cholesterol up, and they're definitely going to keep up your triglycerides.
Yeah. How many others, like in your industry, in your space, operate like you do? Like, are you the outlier? Are you becoming the normal as far as like the different the lifestyle piece that you're taking on, or what's the industry look like?
I would say that I'm still a little bit of an outlier to a certain extent, definitely less so than when I moved back here. But, it's still not part of the culture of looking at this through a lifestyle lens where people are really demanding or wanting better food sources. I don't know exactly what that looks like, but it's still different.
Yeah.
But I also think people are busier.
That is true.
And people are busier. And so somebody says they want to eat healthy or exercise, but they don't have the time. And so that's another thing that's shifted as I have paid more attention. And even to myself is, there's great things that you can suggest I do, and I'm not going to do them because I don't have time. So what do you do first? You have to create space.
Yeah.
And I can give you a couple interesting examples. I had one patient, she said, I would love to do this, but I have no time. So I had just learned the day before, I had learned that you could check on your iPhone how much time you spent on it and what you were doing.
Right.
So I said, hey, look what I learned yesterday. Let's look at what you spend your time doing.
Social media has got to be at the top.
And she was like, oh! And I said, no, let's look. So it was about 2 hours a day, 30 minutes in the evening before bed. And then the rest of it was spread out while she was waiting for kids' activities, doing stuff like that. So I said, okay, 30 minutes almost solid before bed. Can you flip something so that you create 30 minutes during the day? Or when you're waiting for your kids, can you walk instead of do some of these things? And she quickly realized the easiest thing to do was to walk the track while she was waiting for her kids for after-school activities.
Yeah.
So that's what she did. I had another patient, she's, same thing. I want to eat healthier, exercise, but I have no time. I was like, okay, so how can we get you time? She had teenagers, and the thing that she changed at home was kids made their bed, kids cleaned up their room, and everybody helped clean up after dinner. And that added 30 minutes a day.
Like very common sense changes, but
the good thing is the kids, one of the, I can't remember exactly what it is, but kids who have household chores are basically more responsible adults.
That makes sense.
And will give back. I can even give an example for myself. When Walker was home, he was so busy in high school, and I wasn't really meal planning at the time. I was stopping at the grocery store like 4 times a week because I was just cooking on the fly. And finally, I decided I'm going to listen to myself and change this. And so I made a master list of groceries. I asked my husband and my son, what else needs to be on here? And I said, I'm just stopping twice a week and I'll text you before I go. And the first one who asked was my son. He goes, Mom, I need these snacks, specifically cantaloupes, because he was eating like 4 a week.
Yeah.
And I said, I'm not going back to the store for 2 days. And so he stopped, called me, and said, Mom, how do I pick these up? And he started picking up his own snacks. And then, you know what he did? He said, Mom, do you need anything?
Perfect.
And so there were, maybe every other week he would do that second grocery run.
Yeah.
And that saved me 2 hours a week.
Yeah.
When I looked at the time. And so those things seem like, oh my goodness, I don't want to take the time to do that. That's a lot of extra time to figure that out. But you can really find some time savers. And that's really what you need to do before you step in the space of trying to change something.
Yeah. It seems so simple in one regard, but so few people do it. I'm also just hearing you talk about it. It's interesting that this doesn't sound like a typical doctor role, and I started out kind of talking about that, but this is a lot of common sense, but the common sense part there is to help their lifestyle change, and help them think through that. And it really is that, the teacher part you're talking about.
But if you don't have time in your day, you're never going to make that change.
Right.
So we never get to the good suggestions if you can't get there.
Yeah. How much time do you get to spend with your patients? Is that an issue at all? Like, get rushed too much, or do you have?
I don't see as many people as I used to. That's part of it. I just don't have the same schedule that I used to adhere to when I was younger.
Yeah.
Not that I'm old.
I've heard some other friends of mine that are physicians, and they talk about it's hard to really dive into. If they've got 15 minutes because they're trying to just get through as many numbers as they can, and they don't have time to get background and lifestyle pieces. I don't know. What are your thoughts on that? You think that's...
So that's great. So the book that I've written, I like all of it because I wouldn't have put it in the book. Yeah. But one of my favorite is the last chapter of the book. And basically, we don't have a lot of time. But that is the paradigm that we have all bought into. So I can't really change that on my own. So how do I become more efficient? But how do we become more efficient? So I learned this. I spent a long time being medical director of women's services at Erlanger East. And very early on in that career, I learned something incredibly important. Number one, we have an agenda. If you want something on this agenda, you send that to me the day before. Nothing gets on the agenda unless it's a true emergency, unless you send me that agenda. Then, if you have an agenda item, you bring in your information. And we are not going to make a decision until we have all that information, which means probably not during that meeting. And this was kind of an aha, is let's have an agenda. Right? If you want to have a conversation, then let's lead into that. I saw somebody the other day. She came in for a very minor issue, and literally as I was walking out the door, she said, "Can we talk about X?" Which was a really, really big issue.
Yeah.
And I could have said, "Oh, I don't have time." I wasn't going to do that. But I sat back down and we sat and talked about it. And we would have been able to do the exact same thing if she had brought that up at the beginning, but possibly saved half the time.
Yeah.
And so what people don't realize is that if I'm giving 15 minutes here, 20 minutes here, it's not Trisha's time that I'm drinking coffee. It's somebody else's time who is expecting my full attention.
Right.
Because that's sometimes what we forget. And so one of the things I do is I give people a piece of paper that has this list on it, basically, what are your top concerns? What are their changes? So really, you come into the appointment with your agenda. And then one of the things I do to kind of narrow that agenda, if there's a number of different things, is to ask people, what are your top 3 concerns? And if they end up being totally different, then it's like, okay, we definitely need to address this, but how do you want to address this first? So narrow down the scope so we can be efficient and utilize that time wisely. But a lot of people are not centered when they walk in the door, because that's not that's not really, we don't prepare ourselves that way.
Yeah. That's a great
But if
point.
you go, like and what's funny is reading that last chapter, me being a patient right now, it reminded me I was editing it before my first post-op visit. I was like, oh, I need to write down my concerns. And the biggest concern I had was the one that I would have forgotten if I hadn't looked at my list.
That's interesting. Yeah. So it really helped. Your own book's already helped someone. It's helped
It's
you.
helped me. It's totally helped me, which was kind of funny. But I thought, oh, good. I'm going to be efficient and I'm going to get the information. And then if we have a time to chat, we will. But I want to be as efficient as possible so I get these questions answered.
Yeah. Just out of curiosity, what's it like being a doctor yourself, going in to meet with another doctor about, I guess, what their specialty? Is that, I mean, I guess you don't really have a way to compare it, but what's that conversation like, you think, compared to like if I went in and I don't know much about, doctor stuff?
Well, I think it's a different conversation. If you speak the exact same language.
Right.
But also, I think if I don't understand something, I am very clear I don't understand. It's
Yeah.
like, okay, we were talking about my shoulder, little outside my area. If he says something I didn't understand, I'd be like, okay, I don't understand that. What do you mean? So I'm very quick to say if I don't understand, or I'm very quick to clarify. It's like, okay, I really can't wrap my head around the fact that you don't want me to do X, Y, and Z after this. So you're going to have to give it to me, like break it down so that I will listen to what you say instead of trying to do what I shouldn't be doing.
Yeah. In my head, for some reason, I have it playing out like, I don't know if I swore I wouldn't bring up AI. It's just for one little thing.
You can
but
bring up AI.
There's this, apparently they've allowed AI agents or bots to communicate with each other. And there's even like a social media platform called Maltbook. I believe that's right. Maltbook.
What is it called?
I think it's Maltbook or Maltbook. Anyway, it's I think Meta wound up buying it from them, I'm pretty sure, recently, but they allowed agents to go in and basically have their own social platform. And I haven't seen this with my own eyes or heard it with my own ears, but from what I've read, apparently they start talking to each other and it's like a whole nother language. Like they're communicating. So I was wondering if it was the same way with doctors, like 2 doctors go into the room to talk and it just different language
Well,
completely.
if I'm explaining something in lay terms versus only using medical terms, I can probably say something that would take lay terms maybe 10 sentences.
Right.
In medical speak, I could do it in 1.5 sentence.
Yeah.
If you're just super direct, just straight medical, you can just say it a lot quicker and it's more understandable.
Yeah.
I mean, for me.
Right. So, it brings up a good segue for a question about the book. Who's your ideal target audience for this?
So my target audience is for the woman who is curious about what's happening in their body, and they want to use an integrative approach to feel better. So to be open to nutrition, exercise, sleep, stress management, possible supplements, or medical therapies. So open to having that conversation. So the woman who's curious about this, who wants to have a conversation, kind of understand this, and put this into a framework, that's the person who is that's who the book is for. If somebody says, I don't really have much time, I just want a very quick recipe, I can give you that recipe, but that's not what that book is.
Gotcha.
So this is, so that's really what that book is about. and not just give, because a lot of recipes or programs will have 2 or 3 different ways to help you that are true, but may not resonate to everybody. It's like, okay, that does not fit my life. So this has more things to choose from, which can be overwhelming. But you have to just decide, okay, where am I going to begin? What seems like the best place to start? And where should I begin?
In writing this book, is there anything that, challenges for yourself, or anytime you had to stop and I don't reconsider things, like any aha moments just from the art, or the practice of writing the book that stand out to you?
Absolutely.
Yeah.
Absolutely. I think for me, one of the problems that I have is I have so much information in my head and I want to just give it to everybody. And that can feel overwhelming when somebody goes, oh, blah, blah, blah," all this information.
Right.
And so having people read it and say, okay, this makes sense. This is a better way to write it. So it's less overwhelming, so that people can look at it. Yes, there's 10 different things. I don't need to be overwhelmed that there's 10 things. It's really, these are options that help 90% of people. I'll just glance through it, and then I'll choose the one that, oh, yeah, that's going to apply to me.
Is there one, if someone's going to read your book, is there one thing that you want them to walk away with after reading it? One thing that stands out?
Well, I think the underlying approach is really, first of all, what's happening and what's really happening. Okay, because if you stop and really think about it, you might say, oh, wow, I didn't sleep last night. And that's what pops into your head as the first thing that's bothersome. But when you really sit down, you can see a bigger picture. So first, pause and really look at what that picture is, and then be open to other things to test. So a lot of people will come in, they'll tell me, I want X, Y, or Z tested. And it's not that I don't mind doing that, but it may not apply to them. So be open that there may be other things we need to look at instead of just one thing. So don't be too quick to jump to a solution. And then the idea is, how do we respond to what we understand instead of just automatically react? And that is what I've tried to reinforce for myself is, okay, this is what's going on. I'm going to pause, really pay attention, and then come up with a good solution or response. And I'm kind of a fix-it person for other people, so it's nice to make that a little quicker. But I could come up with the best plan, and I could think, oh, wow, this is a fabulous plan. But if it doesn't work with your values, it's not a great plan because you're not going to do it.
Right.
And so bring in your values. If there's something that you feel, oh, I shouldn't tell that person this. And I see that every day. It's like, just tell me. I'm not going to judge you if you say you don't want an exercise. Like, okay, let's try something else.
Yeah.
They're like, but you exercise. So I was like, yeah, I don't get not wanting to exercise because that's my lifeblood.
Right.
But it's not yours. So that's okay.
Yeah. So do you have a release date yet for the book?
No, I don't. So I have a little bit of a pause right now because I have an agent looking at the manuscript. And so once I hear back from them, he'll give me some he has given me a couple paths that he thinks probably would be good for me, but he wanted somebody in his team to review the book. And then he would come back to me, and then I will be really looking at that.
Gotcha.
But from my end, I mean, it still needs editing, outside editing,
Yeah.
but my part's done
Okay.
on the book.
How long did that take you?
It took me 3 months.
Oh, that's pretty quick.
Mm-hmm.
Maybe the surgery was kind of aligned well with that because you had some off time, or not? Oh, really?
No. It was, I have all this in my head.
Okay.
And this is something that I do every day.
Yeah.
And so it was, and this is working full time. So I didn't have a ton of time to do this. But one of the things that was recommended to me was, as doctors, we talk better than we write. And so write down your outline and then talk it.
Okay.
And so that's what I did. And right after surgery, I wasn't typing, so I was doing a lot of voice editing as well.
Okay. So is it all still in audio now, or did you get transcribed?
Oh no, I transcribed all of it.
Okay.
I mean, I did voice transcription, so it immediately went to writing it.
Oh, that's nice.
I just spoke it.
Makes it a lot easier. Huh. So you think, 6 months, 12 months?
I would like to see it out by the end of the year or early next year. And one of the things that I'm building right now, and I really haven't put anything out yet, is I have a domain that I'm going to have a website, so it'll be Patricia McLelland, MD. And then I'm going to start a Substack, but then also post on Instagram and LinkedIn. And one of the reasons why LinkedIn, and it's interesting because several people said, oh, don't use LinkedIn. But one of the things I find, especially for professional women who are in the higher levels of their jobs, that it's fairly lonely. So there's a lot of women, 40s, 50s, 60s, who are in positions of leadership. They may be only one or two, and they're experiencing changes that impact their productivity. If you're not sleeping, how's your productivity? It's not the best.
Right.
But they're also not going to sit and talk about it. And so it's an area where I see the extent of relief that I see when women say, oh, wow, I'm in this position of leadership. I can't tell people I'm not sleeping. I feel awful, and I'm supposed to work at this X level, and I don't know what to do. And once they start feeling better, it's like, oh my goodness, I feel like myself again. And so I have a real heart for women in that space. And I think that's where LinkedIn, people connect there a little bit more in that space.
Yeah, that makes sense. Seems like a great use for it. Definitely does. So I've got some kind of rapid fire questions here at the end for you. All right. So what is the one thing women in their 30s and 40s should be doing that most of them are not?
Great question. Everything we've just talked about. It is much better to prevent health issues than to try to fix them. And so the wonderful thing is this holistic approach. Choose one place to start. I usually recommend nutrition, and primarily because we all have to eat.
Yeah.
You can get away with sitting and moving, less than 2,000 steps a day. You can't get away from not eating. And the wonderful thing about being in your 30s and your 40s is there is a chance that you have kids at home. And if you teach your kids how to eat healthy, it is amazing. You're sending your children out of your house with tools that means that they are likely to be on a better health trajectory just because they learned those tools. The other thing I would suggest too is just movement. Find ways to move more and get creative. The other thing is if you have kids at home, guess what? They love to compete.
Yeah.
And so if you can make exercise a competition. I had a patient the other day who she's homeschooling 4 kids, and she said, I don't have any time. And I said, what about do the 7-minute app with them?
I haven't heard of it. What is that?
7-minute app. It goes through a series of body exercises.
Okay.
It's 7 minutes. And she came back and said, it was great. My kids, they're competing. And so now they're doing more. Now they want to do it 3 times instead of just 7 minutes. And if I fall behind, they're teasing me. And so that pushes me.
Yeah.
And so if we can teach our kids to move more, understand healthy eating in a way that they just demand or expect that, that's what's going to change the trajectory.
Yeah.
And so you're not just doing it for yourself, you're doing it for them too.
All right. Another one.
Sorry, that was a long answer.
No, that's all right. It's a great answer. PCOS specifically comes up in a lot of your work. What are the most common misconceptions patients bring into the room?
That is not a quick answer at all. Because it's
Another podcast?
multifactorial for sure.
Okay.
I think a lot of people don't understand PCOS. A lot of women who have PCOS are overweight. And there are women with PCOS who are thin or have a normal BMI. That's not always understood. The second part that's not understood is a good understanding of the connection with lifestyle. And because of the insulin resistance, it is much harder to see changes with lifestyle. So if you have two women, one's 250, they're both 250 pounds, one has PCOS and insulin resistance, and the other one does not. The other one's going to, and they do the exact same thing. The woman who does not have PCOS is going to lose weight a lot faster. Now that's really discouraging. And but it's a piece of reality that has to be understood. So it's discouraging, but at the same time, if you know that you're not going to get the same result as quickly, then you have that actually is better for what you think of yourself. Like, here I am doing all these things, my friend, it's working, and nothing's working for me. I must be terrible, etc. And that can create a lot of anxiety, depression, self-doubt. And so, it's helpful to say, hey, you know what? This is the reality, not to be mean, but to say, we've really got to figure this out.
Yeah.
And so that would be the big thing there. But that's not a one-sentence answer, sorry.
It's all right. Now I'm like trying to ask these last two as well. They're kind of complicated, but so one of them actually has to do with insulin resistant components. So you've obviously talked about that. Can you break down for someone who has never heard of those words together?
Okay, so pretty much everybody's heard of diabetes.
Yeah.
There's two types of diabetes. One type is childhood, that we mostly think of childhood, where you don't make any insulin. And then what's called adult onset or type 2 diabetes is when your insulin doesn't work very well. And when your insulin doesn't work very well, then it cannot effectively put sugar into the cells of your body very well, which leads to all kinds of health issues: diabetes, inflammation, weight gain, so many health issues that we have. Even Alzheimer's and dementia are associated with that.
Gotcha. And then perimenopause and menopause are finally getting mainstream attention. What took so long, and what do you wish women knew 10 years earlier?
That is a fabulous question, and I'll try to be really fast.
Okay.
So in 2002, a study came out from the Women's Health Initiative, and the lead investigators had a press conference before the article came out, and I was in practice, and they said, basically, hormones are bad. They cause breast cancer, they cause heart disease, and they cause dementia. They cause, all the bad stuff, strokes. And so overnight, everybody got scared, and women were calling and saying, hey, what should we do? And we didn't have the article. Now, that's bad.
Yeah.
That you come out and say that. So then when the article came out, and I was supposed to do a open forum for the community, I read the article, and I called this guy who is like leading in this field internationally. I said, that's not what the paper said. What the paper said and what they were looking for was, do you start hormones on all postmenopausal women to prevent heart disease? The answer is no. That study said the answer is no. They did, but what they did is they applied apples to oranges, meaning in women in their 60s with no symptoms, adding this one type of hormone increases your risk. So it applied that information to a totally different population, which is the population that's symptomatic closer to menopause. And it took about 20 years to debunk that. And so 20 years ago, 10 years ago, I really haven't. I mean, I've always been pro hormone, but you're in this space where you hear all this negativity that patients have a really hard time hearing, oh, but this is what I read, but you're saying something a little bit different. And so if the media had presented, I think I'm not just going to blame the media, but if the media had presented even some of the later studies which were much more favorable, had given even remotely the same amount of press, we wouldn't be here today. It wouldn't have taken 20 years. It would have taken 5 years.
Yeah.
Maybe.
Right. It's wild, the power of the media. I mean,
it is wild. It is wild, but it impacted the medical community too. So you read, oh, this is terrible. I'm a good doctor. I don't practice women's health, but I read all this stuff. This must be bad.
Yeah.
Right? And unless you go back to the original article and read that, it's hard to understand that because all the reactionary articles are all negative.
Right. Right. Well,
you didn't ask me why I came back to Chattanooga. That was one of your questions.
Hit rewind. Why did you come back to Chattanooga?
I was so excited about that question.
Oh, man,
people don't ask me that question.
This is the perfect time. This is the best time to answer it. Yeah.
Well, I was at a point, I loved Portland, but I was at a point that I was thinking, okay, do I stay here or do I move? And I would have been open to moving anywhere in the world. Yeah. I really was. And my sister just had my first niece, and I came home to visit this beautiful girl who was still amazing.
Yeah.
And I reconnected with my now husband.
That's
and
awesome.
What was funny about that story, too, is that before I came back, I looked to see if there were any job openings in Chattanooga, and there was not. After that weekend, I looked like a week later, there was a job opening.
Meant to be.
So, met my husband, job, and an adorable little niece.
That's awesome. And somehow I missed that question. Is there anything else I missed?
Nothing else you missed.
How would you summarize this podcast? You think, well, first, before we forget, because I want to forget this, people can find you looking up, of course, Dr. Patricia McLelland. You'll have your website coming out with the book.
Yes, and it'll be my name, Patricia McLelland, MD.
Okay.
Right now, I mean, I'm in private practice with Galen Medical Group, Galen OBGYN, and we have a website and stuff. And I would say the way I would summarize this is really to be mindful and to think about what you're feeling. Go to a practitioner who can help you sort out what additional tests. It's great to look online and to decide what you need, but to be open that maybe there's some other things that would be helpful to look at as well. And then look at all of these options. Look at the lifestyle, look at the medical therapies. What are your values, and how quickly do you need to feel better? And look at it all together. And then, because this is really complex, if you take the time to make each of those steps, you really are probably going to get the best plan for you, but it's not necessarily going to be the plan of the person sitting next to you.
Gotcha. Anything else I missed?
No. One of the things that I appreciate you
yeah.
is you are very curious.
I am very curious, to like a curious cat.
I love the curiosity. And one of the things, this can feel fairly lonely for women, especially when their behavior seems to change and they're not as easygoing. And so keeping this conversation open with their husband, boyfriend, friends, is so helpful, because I think as men start understanding these are changes, these aren't personality changes. But you know what? If you aren't sleeping and you woke up 4 times every night with night sweats and you had to go change your clothes, would you be crabby?
Yeah.
Possibly.
Yeah.
And so when somebody's experiencing that, giving grace and space to figure it out and come up with realistic solutions is only going to help both people.
Yeah. Yeah, very
So
true.
I love your curiosity.
Well, thank you. I'm curious for a lot of reasons. And, and actually, now you bring that up, I have seen older friends of mine where their wives have gone through this, and I've seen some of the challenges firsthand, and some of them actually wind up getting divorced, it seems like, because of it.
There's actually a really high bump up in divorce rates during that period of time.
Yeah, I could see why. And it makes sense what you're saying. Like, it's kind of even as for men, one of the reasons I'm curious is because, there's really male and female both. It seems like maybe because food supply or I don't know what, but there's hormonal issues with everyone in the United States, it seems like, once you get past 30 especially. And so I turn 41 next week, and it's something that I've been monitoring, trying to figure out on my own, So that's part of the curiosity, because of course, men and women are different, and we don't go through menopause necessarily, but we do start dropping testosterone after 30, what they say. But then you add the food supply and all that to it, lifestyle pieces, stress, So that's part of my curiosity. A lot of it seems like applies to men as well, just for...
Oh, yeah. Most of what we discussed applies to you as well.
Yeah. Yeah. So that all really resonates.
So I am going to have to let you know when I start my web page.
Okay.
I'll let you know that.
Yeah, perfect. Let us know if we can help. Would love to. And I see it's been really valuable too I know I'm not talking about AI, but with the webpage, with the LinkedIn, with the book, that's perfect for the amount of searches now on AI. People are looking up for this. And in fact, I saw a stat earlier this week where, Google now has an AI overview that will give you for not all searches, but for a lot of them. And the highest ranking AI overview search is around healthcare now. So it's like 47% of healthcare questions now return with the AI overview in Google search. So what you're doing, the writing LinkedIn post or LinkedIn ads and your own website and the book, I think that would really work well for that.
The 3 things that I think about. So I think about, number 1, the most important thing is to empower women to better health. Not against anyone, but to better health. The second thing is I want the information to be accessible. I want it understood, because there's so much of this that's complex, but also a lot of it that's simple. But then the most important is this actionable?
Yeah.
And so anytime I write something, those are the 3 things that I ask myself, have I done that? And if I haven't, then I need to rewrite it.
Well, I look forward to reading the book when it comes out.
Thank you. Thank you so much.
Yeah. Thanks for coming and talk about it. I will probably have to listen to it. I'm just going to say I will listen to the book. I'm hard at reading, but...
Oh, you're going to have to read it.
Really? Okay. All right. Well, it'll take me longer. It takes me a while to read, but
That's okay. Yeah. Maybe I should be the reader.
Yeah. Yeah. Do an audiobook. I think it's
I can do an audiobook.
Yeah. I think it's a good idea. On Audible?
On Audible, yeah.
All right. Well, I'll stop ranting. Thanks for coming on and talking about the book. It was a lot of fun.
Thank you so much.